Hello, my name is Selina Graham and I'm presenting to you Telephone Fracture Clinic Consultations, a satisfactory solution in lockdown. And this is work I've done over the last year at Southmead Hospital. So we're going to go through an introduction, our aims, the methods, results and conclusion. The global COVID-19 pandemic accelerated change in almost all spheres of life and in particular healthcare delivery. NHS England and the BOA published guidance on management of patients with urgent trauma and orthopaedic conditions. The aim was to minimise patients' risks of COVID-19 through reduced contact with acute hospital services. In accordance with this guidance, Southmead instituted changes to the delivery of fracture clinics. The primary driver was recognition that there were likely to be conflicting anxieties in the patient population relating to both their injury and the pandemic. Changes were proposed that addressed these anxieties and in addition offered time-critical injury assessment and potentially reduced institutional footfall. The proposal was for telephone screening consultations for both new and follow-up fracture clinic appointments, addressing both the injury and the pandemic-related anxieties. The primary aim of this study was to evaluate patient satisfaction with the fracture clinic telephone consultation system that was used in Southmead during the COVID-19 pandemic. The secondary aim was to elicit their opinion on this versus the conventional approach. And thirdly, to investigate whether there was any difference in satisfaction based on age group or appointment types. This was a retrospective study of 299 patients who had fracture clinic appointments delivered by telephone consultation between the 18th of March 2020 and the 25th of April 2020. Of these, 10% were new injuries and 90% were follow-up. All patients were aged 16 or older, and all of these patients were sent a postal satisfaction survey, as demonstrated on this slide. With a response rate of 43.8%, our results showed overall positive feedback, as seen here with the large green bars. Although 78% of patients stated that they preferred a telephone consultation to attending a face-to-face hospital appointment during the pandemic, only 22% stated that they would have preferred this in normal pre-COVID times. Interestingly, 62% of patients stated they would be happy for future fracture clinic appointments to be carried out via the telephone system. Of the 48 patients who sought further advice, 12 attended further planned face-to-face appointments and 13 used their open appointments to arrange a further face-to-face consultation. There was no statistically significant differences in response nature when stratifying against categorical age or appointment type. In conclusion, although most patients stated they would not have chosen a fracture clinic review by telephone in pre-COVID times, the majority stated that it was their preference during the pandemic, and 62% would be happy to have future fracture clinic care delivered in the same way. Patients were adaptable to this alternative method of care delivery, and there could be a role for its integration into the options for fracture clinic delivery in the future.